and I call the member for Hasluck.
Thank you, Deputy Speaker. I, together with the member for Moreton, we're currently wearing continuous glucose monitors because he is chair of the Friends of Diabetes, Parliamentary Friends of Diabetes, or enemy of diabetes, perhaps is more accurate, together with Diabetes Australia. I reckon it's a good idea for politicians to actually understand what people with diabetes have to live with, and they're right. And I'm proud that in July 2022 this government has provided all 130,000 Australians with type 1 diabetes with access to subsidised continuous glucose monitoring, as I'm wearing on my arm today. And Labor will go to the election next year with good news too, to tell in the health portfolio, namely that it's central to the way in which we have begun the long task of strengthening Medicare after years of coalition neglect. The coalition are forever lukewarm at best on Medicare, when they're not actively undermining it, that is, because the Australian people remind them from time to time that they had better not mess with it. Medicare remains a beloved legacy program based on the premise that your access to primary health care shouldn't depend on the size of your wallet. Labor introduced Medibank in 1974 and was met with vehement opposition from the Conservative parties. Just how much opposition? Well, a double dissolution and joint sittings worth of opposition. Nevertheless, it got through. Then, after 1975, the scheme was white-anted and then abolished by the Fraser government. In 1984, Medicare was introduced, and again with opposition from the Conservatives. Over the years, we see coalition leaders like Howard and Abbott talk about getting rid of Medicare, then recanting when they see it's too popular, then pretending to be Medicare's best friend. We won't get rid of any Medicare locals, said Tony Abbott in opposition in 2013. All 61 were scrapped as soon as he came to office. The coalition doesn't oppose universal health care directly anymore because they understand the electorate won't stand for that. Instead, they just let it run down. And once it is run down enough, they'll try to point to it as a failed system. It's the old coalition privatisation playbook. Now, the people of Hasluck, they voted for Medicare at the last election. They voted for a Medicare urgent care clinic in Midland, and now there is one delivered, and operating extended hours at North Street Medical Centre, located close to the town centre of Midland. People needing care for themselves or their children can attend and have the whole of their urgent treatment bulk billed. The government promised 50 Medicare urgent care clinics at the last election, and we've already delivered 58. In this year's budget, we have committed to create another 29, with $227 million of funding to bring the total number to 87. Australians are appreciative of this new service, with over 400,000 presentations to urgent care clinics already. And more than 25% of those presentations were children under 15 years of age, and more than a third were outside of regular hours, and half of them say they would otherwise have presented to the emergency departments of their hospitals. I'm also pushing for a second urgent care clinic to be established in Hasluck. Ellenbrook Township is the centre of what is possibly the fastest growing urban corridor in the country, and it remains underserviced in many ways. There is no hospital base there yet, and there is a great need for more and more varied health provision. An urgent care clinic will bridge the gap for many of our local residents. Last year's budget included a $3.5 billion investment to triple the bulk billing incentive to benefit more than 11 million Australians. As a result, the GP bulk billing rate has risen by 2.1% in the first 5 months of that policy, and this translates to an extra 950,000 visits to the doctor. We can add to this cheaper medicines by virtue of the caps on scripts and the transition to a 60-day scripts for many chronic conditions. The coalition were advised to allow 60-day scripts back in 2018, but they scripted it, meaning that millions of Australians have paid too much for far too long, waiting for a government that cared enough to see that job done. These policies underpinning the health of the Medicare system, making medicines cheaper and increasing bulk billing rates, are obviously good for people's hip pockets too. At a time when cost of living is an issue, the government's actions in the health portfolio serve to act as a brake on inflation and to help out with the family budget. Labor's investments in Medicare are good for the health of Hasluck. They're good for the country at large. And I thank the member for Macarthur for this motion in recognising his unrelenting advocacy for Medicare and across the gamut of the health portfolio. It is something that for anyone wearing this to any other condition, they can trust that Labor has their back and their health in mind.